if a mother uses opiates, such as heroin, while pregnant, that can obviously mean real problems for the child. Namely, the infant would be born with a dependence on that drug. Our Sussex County Bureau Chief Evan Kozlov joins us now live in the Bureau in Milton. Evan, there's a state committee now trying to help these babies and get involved before really what's a bad problem gets even worse.
Yeah, hey there, Steve. The group is called CPAC SEI Committee. Yeah, it's short for a much longer name, and their recommendations look to address the problems of infant addiction and parental neglect. Jennifer Donahue is the co-chair of CPAC SEI, aka the Committee on Child Protection Accountability Commission, Substance Exposed Infants. Donahue says their goal is the care for infants born with substance addiction. She says it's a growing problem in the state.
These infants are vulnerable. These infants deserve to be safe.
Donahue says the committee was started about a year ago, and on Friday they voted to add 6 changes to their reporting protocol. Automatic contact with the Delaware Division of Family Services would be triggered by a variety of conditions, including the use of illicit drugs by the parent, complexities in the medical care, and a lack of visiting or care from the parent.
This issue is a public health issue, and many agencies are currently coming together to assist these infants. But with this protocol and with our draft legislation that our committee is working on, we hope to formalize that.
Meanwhile, here at BB Healthcare in Lewis, administrators are hopeful that the changes will have a big impact. Last year, the Division of Family Services investigated almost 300 cases of babies being addicted to substances. That includes 105 cases in Sussex County alone, by far the highest amount compared to its population. Bridget Buckaloo, the executive director for Women's Health at BB, says the issue needs to be made a priority.
We can't close our eyes. You can't turn your head. It's here, and it's a reality. And they're going to be in our schools. This is our future society. So what can we do as the village to take care of these kids?
Action taken to try and curb a growing problem in the first state. All right, now the 6 conditions were initially recommended by a group called Delaware Healthy Mothers and Infant Consortium. Now the committee will have to formally vote on the entire protocol that's expected for March or sooner. Reporting from the Bureau, I'm Evan Kozlov. Back to you, Steve.
All right, Evan, thanks. Let's talk about how big of a problem this is. A look at the total number of investigated reports of infants being dependent on drugs. In Newcastle County, there were 110 such cases in 2015 compared to 84 cases in Kent County. But in Sussex County, look at that, 105, the highest by population in the state of Delaware.